Good evening, everybody. You have successfully made it to our COVID-19 and vaccinations questions and answers for people with developmental disabilities and their families. We're super excited that you're here tonight joining us. My name is Stacy Dim, and I'm the Executive Director of the ARC of Washington State. I'm also a family member, a sibling of someone with a developmental disability. I have tonight three very important guests, Dr. Gary Stobbe, Dr. Alan Gill, and David Eaton, who's a registered nurse practitioner with the Children's Autism Center. And we've got a great night of questions for you. I do have a co-host with me here tonight. This is Jessica Renner. Jessica, do you want to introduce yourself?
I'd be happy to.
My name is Jessica Renner. I am the administrator for Self-Advocates and Leadership SAIL. I have a developmental disability in the form of cerebral palsy.
Thank you, Jessica. And then manning tonight's technology, the most important person of all is Diana Stadden, who's giving us technical support and going to be flagging questions for us as we go along. Thank you, Diana. Do you want to say hi?
Hello, everybody. Watching for those questions.
So we're here tonight again to host a question and answer forum on COVID-19 and vaccinations as it relates to the developmental disability community. And tonight our focus is on information and questions for and by people with developmental disabilities and from parents and family members and their caregivers. I feel like we have an action-packed night, and we're thrilled to have with us tonight three extremely specialized, skilled, and trusted professionals in our world of developmental disabilities to give us all a little perspective and some information. I'm really grateful for their time and expertise. As you might have noticed, we're recording this event and we are live with closed captioning. We'll have it available for viewing at the ARC of Washington website with just a few days. And we'll also send along some links and information for those of you who registered for this event. So you can catch this if you have to leave early, or if you want to hear the questions again or the answers again, or pass it along to friends, please feel free. We do have about 75 people registered tonight. We expect that people will kind of join throughout the hour. This is a webinar format, so just for the attendees to know, you won't be able to have your camera on or talk, but you can type questions in the chat and you can type questions in the Q&A. We do that just to kind of reduce the noise and the hubbub that can happen in an open Zoom, but we definitely want this to be as interactive as we can. So I'm gonna get this going here and introduce our guests. But Jessica, why don't you start us off with just a little bit of perspective on COVID-19?
COVID-19 has had a devastating effect on our world population, and Washington was the first state to identify someone with COVID-19 in the U.S., as most people know. It has had a particularly devastating effect on older people and people with disabilities living in congregate care settings or who receive care from shift staff who may work in more than one job and in a variety of settings in addition. Many people with disabilities have underlying conditions that may make them more vulnerable to COVID-19 effects. For example, recent data shows that people with Down syndrome may have up to 10 times the likelihood of severe infection or death when they do get COVID-3. After I get the vaccine, can I still carry coronavirus and still spread it to other people?
Thanks, Jessica. I think you had an extra question populated there. You'll be ready for that in just a few minutes. Thankfully, you know, we do have vaccinations that are becoming more and more widely available, and this will help prevent and protect from the spread of COVID-19. Some of the information about vaccines and their risks and their benefits can be really confusing for all of us. And so it's important to know what information is accurate, and we all have good information to make good decisions about our own bodies and our families. So thankfully, we have experts like our panelists here to give us some unique perspective. This space welcomes all questions. So definitely people that have joined us, all your questions are valid and important. We want to hear you and we want to provide you accurate answers. So here we go with our panelists. It is my pleasure to first introduce Dr. Gary Stobbe, who's a neurologist and medical director at the UW Adult Autism Clinic. Gary, do you want to say a little bit about your background?
Sure. Thanks, Stacy and Jessica and everybody out there listening. I'm Gary Stobbe, and I'm an adult neurologist by training, and work now exclusively with people with intellectual and developmental disabilities and neurodevelopmental conditions, and split my time between University of Washington and Seattle Children's. So excited to be here tonight.
Thanks, Gary. And then next, Dr. Gill. He's a family physician from Tacoma with an adult developmental clinic and a large panel of patients with intellectual and developmental disabilities. Dr. Gill, you want to tell us a little more about yourself?
Hi there, I'm Dr. Gill. I'm in Tacoma. I'm a family physician, so I care for individuals of all ages. I've over time developed an interest in individuals with developmental disabilities and have a large part of my practice as adults, primarily with developmental disabilities. And a couple of years ago, helped Multicare open a clinic for teens and adults with developmental disabilities to help with transition and to support throughout adult life. I also am a father. I have a 28-year-old son who has autism.
Thanks, Dr. Gill. That's great. And then finally, we have David Eaton, who's a registered family nurse practitioner at the Seattle Children's Autism Center. David, you want to tell us a little bit about you?
Yeah, I'm born and raised in Seattle, and I've been at Seattle Children's Autism Center with Dr. Stobbe now for 10 years. I also have a family member who has a developmental disability, and that was kind of my introduction into the, at least kind of I think my spur into this work, I feel. And I'm also on the board for the ARC of King County, and I'm the King County representative to the ARC of Washington board as well. So I'm very familiar with Stacy for sure.
We really appreciate you. Thank you for that. Okay, so I'm going to have David Eaton kick us off a little. And David, I've heard you speak on this topic before. And inspired by my granddaughter, I brought my own model of the coronavirus, but I know you have a better one that I was hoping you'd share with us and give us the scoop on what is this virus and what are we talking about?
Yeah, I have it ready, queued up here. This is my wife is an infectious disease physician, actually, with the UW medical system and Swedish medical system. And she is also an artist, as you can tell. She made this paper mache coronavirus back, I think it was in like April or May. She kind of spent a lot of time on it. This is a good kind of prop, I think, to kind of tell us the introduction about the vaccine and the virus. You know, when researchers encounter something that they're trying to treat, they're trying to look for what are targets, what are ways to identify to help our immune system become ready and primed and able to kind of recognize something that's foreign. And so these, like you had on your little example, Stacy, and like I have on this example, these red little plush puffy things are supposed to represent what's called the spike protein. People may have heard of that. The spike protein is one of then what the scientists have looked at as a target, because it's kind of an identifying marker for if you were to get infected with coronavirus, COVID-19, with SARS-CoV-2, then your immune system should try and figure out, hey, what is this foreign thing? How do we recognize it? And that's kind of how scientists have tried to develop vaccines. Two vaccines that people know about probably in everyday life so far are the Pfizer and Moderna vaccines. Those two vaccines take the DNA process, what's called mRNA, part of the DNA process, the mRNA section that actually codes for these little spike proteins. This is how one of the ways that then the virus really attacks your body and attacks your cells. And so having these little spike proteins, the mRNA from these spike proteins in the vaccines is how then it gets into your body. And then it's just only the mRNA for these spike proteins. So then your regular cells start to figure out that mRNA and kind of read that mRNA and produce these spike proteins, so that it kind of is like a trial run for your immune system to be able to respond and recognize these spike proteins ahead of time when you get the vaccine. So that then the idea is, now that you have the immune system that can recognize these spike proteins, or to be infected, your immune system's already primed and already ready to kind of fight off the infection before you get too sick. In the clinical trials for the two mRNA vaccines, which again are the Moderna and Pfizer ones, people in the trials, which is 30-some thousand people in one trial and 40-some thousand people in the other trial, no people who got then the vaccine, when they got infected, you can still get the virus, but they didn't need to be hospitalized. Their immune system was already primed, and nobody had died even and nobody had died and nobody had even been hospitalized in those clinical trials when they had the vaccine on board. The other three other vaccines that are down the pipeline. One that Dr. Gill had just mentioned he had seen is kind of coming up on, with maybe a FDA review this Friday from Janssen and Johnson & Johnson, and then two others, one from AstraZeneca and one from Novavax. Novavax actually got a lot of research through the Kaiser Health System in this greater Seattle area. All of those actually don't use the mRNA, but they use kind of an older model of vaccines, or just are kind of, quote, maybe usual model of vaccines, where they use some variation of usually like a cold virus, like a adenovirus, to then carry the spike protein into the body, so that then again, your body does the same thing, so it can recognize the spike protein ahead of time, and be able to be primed and ready to fight off any chance that you were actually had a COVID exposure.
That's some pretty amazing science, actually. It sounds complex, but it also sounds like we're super lucky to have these vaccines available to us. There's a lot of vaccine hesitancy. And so let's talk about some of the information that might help people feel a little less afraid of getting the vaccine, or feel more confident knowing how to manage the decision when it's available to them. So Gary, tell us a little more about the vaccine itself. I know some people have worried, does the vaccine have a live virus in it, and can you get the virus from the vaccine?
Yeah, that's a great question, Stacy. And I think that as David explained, with the vaccine, it is not the virus. You are not getting the virus into your body when you get the vaccine. What it's giving is just some information that helps your body react to one of the proteins that is present on the virus. So you cannot get COVID from the vaccine. So that's a very important point for people to understand. And there are some older types of vaccines that actually do use what's called live attenuated virus, and these are not that type. Kind of like you said, Stacy, we're pretty lucky to have the science that was ready to roll this type of vaccine out for us.
It is pretty amazing. Dr. Gill, how come some people get symptoms from the vaccine, and what are the symptoms that people should expect, and what can they do about them? Should they worry about the symptoms?
So the reason people get symptoms from the vaccine is just what David was talking about. Your immune system is reacting. So most of the side effects are directly related to your immune response to the vaccine itself. And so mild side effects are actually pretty common, and they're not dangerous. About half of people will have kind of whole body symptoms. like aches or headaches, possibly low-grade fever. They tend to happen in the first couple of days and then they go away, and people don't get severely ill from them. Even more people will be sore at the shot site, something like 4 out of 5, maybe even more. Some will get kind of redness and swelling. Again, it comes up in the first few days and then it goes away. So some degree of side effect is quite common. It's normal. It's part of the immune response. If in that process you're worried, you call your doctor and describe what's going on, and they can decide if you need to do anything more. I think we touch on more severe potential side effects a little bit later in the talk around allergic reactions, which is the one major worrisome side effect, and we'll come back to that.
Can some people just take something easy like Advil or Tylenol if they have symptoms?
Yeah, so we don't recommend routinely taking anything, but if you do get aches and fevers, Tylenol or Advil, ibuprofen, those are totally fine to control the aches and the headaches, and if there's any fever, those are fine.
Yeah, one of the things I've been advising Stacy is if your loved one has trouble communicating, if they have difficulty communicating, maybe the night after getting the vaccine in the day, maybe that night taking some Tylenol before going to bed maybe is a good, safe thing to do. But so far, so good. People have been doing really well.
And I have done the same in terms of nonverbal, where I'm a little more worried. I have had people pre-medicate. In general, we don't do that. And I guess the other thing to mention is at the time of the vaccine, they do give you a chance to sign up for a national, it's actually a phone-based app where you can report your side effects, and then that helps us learn about the vaccine. So for many people, that's a great thing to sign up for, if you can, so we learn more about what people experience.
Yeah,
I'll just add just my own personal story, only personal story, but when I got my second dose, I had no real reaction to my first dose of the Moderna vaccine. I just got it in my left arm and it was a little bit sore, but I could still move my arm, compared to like my wife, who I said works in healthcare also. She got her first dose and she said it felt like she had just run into a brick wall, you know, really kind of quite sore. But then when I got my second dose, when she got her second dose, she had no real side effects. Compared to when I got my second dose, I didn't take, like Gary maybe suggested, maybe some prophylactic kind of medication, some Tylenol. And I was up all night just kind of with body aches and just couldn't kind of really settle down and go to sleep until I finally around 2 a.m. took some Tylenol, and I kind of slept through the rest of the night. But it was definitely, you know, a noticeable feeling that my body was having.
Yeah. And that's the thing, that's normal for some people, to have that. And I had similar with my second dose, and then it's amazing how then quickly it just goes away, you know, and just by the next day it was pretty much gone. So, so that's normal.
That's good information to have. And then speaking of medications, Jessica, you've got a question about medications.
Are there some medication?
I don't have any. Hang on.
Are there some medications that might make someone more at risk of side effects or reactions from the vaccine?
I'll take that, Jessica. So, you know, I think that some people have medical conditions in which their treatments affect their immune system. So there's conditions like in my field of neurology, conditions like multiple sclerosis or myasthenia gravis. These are conditions that affect the immune system. Other people have conditions like rheumatoid arthritis or lupus. And so some people are on treatments that affect their immune system. And some of those treatments can block the benefits of the vaccine. And some could possibly increase risk for side effects. But also the thing is, those conditions are even at a higher risk if you get COVID, if you get the disease. So just about every organization that represents these conditions has come out and said that people should still get the vaccine. I think you have to talk to your doctor that prescribes those medications to make sure you know the timing on when to get the vaccine. related to the timing of your immune medication. Is that, Alan, Dave, does that sound reasonable?
Great answer, I think.
I completely agree.
Okay.
We have a little bit of a related question in the chat up here. It says, do individuals with developmental disabilities and epilepsy have any special risks of getting COVID?
You know, I think I saw that question, and I think where the risk is for getting COVID is that it's hard for some people with intellectual or developmental disabilities to follow all of the safety guidelines. You know, it's harder for some of my patients to wear masks or to remember to be 6 foot distanced or wash their hands. So I do think if a person has trouble following those guidelines, then they are at higher risk to get COVID. But the condition, the underlying condition itself, I don't know of any that increases the risk of getting COVID. Yeah.
That's great. And then this is a general question. Why do we have to get 2 shots of the vaccine? There's some reports now that maybe 1 shot is good enough. And then what if I get the first dose and I have a hard time getting an appointment for the second dose? What should I do?
Good question. Well, the second part is definitely in the media lately, just with our wild weather that we've had throughout the entire U.S. And I know that throughout Washington State, like specifically the Moderna vaccine was delayed in being shipped to Washington State, and some people, my family, even one of my parents was scheduled to get it last Friday, and it didn't come. It wasn't available. Luckily, I just saw that shipments have kind of picked back up, and my family member then got scheduled for later this week. And the main key is that then if you're delayed, just kind of wait to get rescheduled, be patient to get rescheduled. The CDC has some guidance that's, they're in the clinical trials for Pfizer, they dosed it 21 days apart. In the clinical trials for Moderna, they dosed it 28 days apart. So usually they try and kind of hold very closely to that 21 or 28 day period. But also the CDC says, hey, as long as you get it within 42 days, you're still expected to be just the same, just as well covered. So I think that's some good guidance, and to be patient with, at least, and patient through the process of getting that second dose. Other medications or other vaccines are being trialed in the UK with just 1 dose, and I think that's the case for the Johnson & Johnson vaccine, which may be the 3rd one that's approved. So that's something to pay attention to. I guess my answer on that part is just that, it's just based on what the drug companies are trialing out, and kind of going with the research and seeing how that pans out. So there's no clear, at least that I have any clear science on why 1 versus 2, but definitely the first dose is effective, about 50% effective, if not more. But really that right now for the 2 that we have available, Pfizer and Moderna, it is important to get that second dose. Any other thoughts, Gary or Alan?
Essentially all the vaccine sites are offering or scheduling your second appointment at the time that you get the first. So we're setting people up to successfully get that. Of course, you mentioned the weather interruption, which has thrown things off a little bit for a subgroup of people, but in general, we're scheduling the second as soon as you get the first. Yeah.
And I would add that in the studies of the Moderna and the Pfizer, that you got a significant bump up in the effectiveness of the vaccine by getting that second dose. So instead of just being about 50%, it went up to 93 to 95% effective without any apparent increased risk of serious side effects. David, you mentioned the side effects of the body symptoms for 24 hours. That's increased, but the safety of the vaccine is just as safe with the two. So definitely encouraging everybody to get the 2. Yeah.
Great. And then we have another question in the chat. If I've had COVID-19, should I still be vaccinated? And should I get both doses?
Yes. is the answer. You should, if you you should check with either your doctor or your if you have COVID-19. I don't know the exact kind of waiting time, but if you currently have your immune system's already reacting, you shouldn't get the vaccine right then and there if you're already exposed to the virus and have active infection. But after you've recovered, it would be advised to still get the vaccine. It's much more it seems to be much more beneficial to have the vaccine than just having any lingering antibodies from the exposure.
Yeah.
Great, thank you guys. And Jessica, I think you have a question for us about after I get the vaccine.
After I get the vaccine, can I still carry coronavirus and still spread it to other people?
Yeah, great question, Jessica. I'll jump in on that one. Just that, this is an area where we wait for the scientific process, and there's nothing that tells us that, you can't kind of, that, oh, you're immune, you're, completely immune from passing it on to people and from carrying it. So we still say, once you've gotten the vaccine, still take precautions, still mask, still have face shields, whatever you can comfortably protect yourself. And really, in that case, you're protecting others, especially. If anything, it's almost like it would be harder to know from my perspective, oh, I might have just gotten exposed and my body might be successfully fighting off a coronavirus infection. So I'm actually not getting sick, but I'm also might be producing enough of the virus while my body fights that off that I could be, coughing or breathing and kind of passing it on to one of my family members or somebody that I'm out visiting with. So it's still very important to still take all the precautions, even after you get vaccinated.
That's great. And we also have a question. What happens specifically, or what considerations should you make if you're diabetic?
Yeah, I mean, most treatment for diabetes is not going to affect the immune system. So it's not going to block the effectiveness of the vaccine. Again, you should always probably review, if you have a complex medical condition, I would definitely want your main doctor to give you the go-ahead. We can't be your doctors in tonight's event. At the same time, we know that people that have underlying medical conditions, those are the people that are at highest risk for bad outcomes from COVID. Those are the people that are at greater risk for hospitalization and death. And so people with more serious medical conditions, those are the people that we want to get the vaccine, because there's a lot we don't know, but what we know from the studies is that the vaccine is safer than getting COVID. Mm-hmm. So that's the important message.
That's an important message, really. And then Jessica, you've got another question that's similar to this one about issues for people with developmental disabilities.
What are the issues that people with developmental disabilities should think about before getting the vaccine? For people who have autism, or cerebral palsy, or Down syndrome, or epilepsy, or other disabilities, are there questions they should ask themselves? Is there any reason to not get the vaccine if I have a developmental disability? Is it more dangerous for me to get the vaccine if I have a developmental disability?
Yeah, that's a great question, Jessica. And again, this comes back of what we know and what we can't prove yet, and what we know. Again, this is the same as the question about the diabetic or medical illness. We know that people with Down syndrome and a lot of people with other developmental disabilities have more health issues. They have they're at higher risk for other conditions. And so early on in the COVID pandemic, it was evidence that people with intellectual and developmental disabilities of all types were a higher risk for having hospitalization and death from COVID, from getting the virus. We do not see any evidence that the vaccine is any riskier. So again, I think that's where for me it says, wow, if I've got one of these conditions, it's even more important for me to avoid getting COVID. So what are my ways to avoid getting COVID? 6-foot distancing, wearing masks, washing your hands, and now getting the vaccine is the way to avoid getting COVID. What do you think, Alan?
I mean, I would echo that. I think that we know specifically Down syndrome, there's clear evidence that people with Down syndrome are more vulnerable to COVID. And we've seen similar things with influenza, the flu with Down syndrome. So we know that group. For many groups, there's not enough data, we really don't know. But I think anybody with chronic medical conditions is more vulnerable. So cerebral palsy, where sometimes breathing is affected, I would consider people with cerebral palsy to likely be more vulnerable, even though we don't have numbers. And so and I think the other part of vulnerability is where you live, and if you have many caregivers, or if you have trouble, as been mentioned, wearing protective things like masks or keeping distance, caregivers who have to help you physically, that makes you more vulnerable to getting the virus. Yeah. So I really feel like I strongly recommend this in the developmental disability community in general. And I'm not aware of any specific subgroup who's more likely to have trouble with the vaccine. So I make a pretty broad recommendation to my patients. And we have had in our supported living community, we've had some deaths. They were older patients who also had other medical conditions, but we have seen it in the supported living community here in Tacoma. And I'm so glad we got the vaccine and that it's starting to get that population protected.
Yeah, me too. That's great perspective and information. Some people are concerned, they've heard that if they have severe food allergies, like to peanuts or eggs, then those are the foods that mostly get brought up. Should they be worried about a reaction to the vaccine? And what if they use an EpiPen for past allergic reactions? Should they think twice about getting the vaccine?
Yeah, so I think about allergies in kind of 3 groups. So food allergies, there is not an issue. Latex allergy, which could come up in our communities, is not an issue. There's no latex in the vials or anything else. And so for those, there's not even special caution, except we watch everybody for 15 minutes because there have been rare allergic reactions to the vaccine itself. And so, but food allergies will watch people for 30 minutes, but there is no special worry with food or latex allergies. The second kind of allergy is injectable medicine. If you've ever had a reaction to an injectable medicine, that's a little more worrisome, but we still do the same thing. We give it in a medical setting where we would be prepared to treat you, and we watch for 30 minutes. The one group that really does matter is the true allergies, people who've reacted to this shot or something in it, and that's polyethylene glycol or polysorbate. So those are ingredients in this particular vaccination, and they'll ask you about those before they give it. So the only group that shouldn't is people that have a true allergic reaction to the shot itself or something that we know is in it.
And then I've also heard that people who are pregnant maybe shouldn't get it. Is there any other group of people who really should not get the vaccine?
This really kind of goes back to the, who's been studied, who's been, who was part of the Pfizer and Moderna trials. And so that's why there's some hesitancy, just because then they weren't part of the trials. But I also know a lot of, friends of mine who are currently pregnant, and they've had guidance from their OBGYNs, their family doctors who are following their pregnancy to still get the immunization, to still get the vaccine. So again, another question that's important to bring up considerations with your person who's kind of tracking your pregnancy, I would say.
Yeah, and I would say that the vaccines are only approved nobody below the age 16. So that's reason not to get it. And those younger age groups are still being studied. So the hope is that the vaccine will become available for younger ages as we get into the summer and later into this year.
Okay, that's good information too. And now just to add on to it, what about these newer versions of the virus that we keep hearing about? Will these vaccines still be effective? And do we have to worry about getting another vaccination for new versions of the virus?
It's a good question. I got a little a spreadsheet or a list of this information from my wife, who I said, you know, works in infectious disease. The one that we're most concerned about currently is this B117 variant mutation that's been originally most prominent in the UK and definitely is now throughout the US. I've seen some of the mathematical kind of projections that say it's going to be the more dominant version of the coronavirus that's out there. Just by the end of the month here, it's going to kind of, you know, be the most dominant. And it's about 50% more I guess just a transmissible 50% more aggressively in that, I guess, in that way. The nice thing is that then the research shows that both the Moderna and Pfizer are just as effective against this B117 variant. There are a couple other variants that are less common or have not been seen as much in the US that have some interesting mutations that scientists are worried about, and they're continuing to assess. Again, is the Pfizer, is the Moderna as effective, or it might be a little bit less effective against some of these other variants. But I think the more important one that we can say with some good certainty so far is that the B117 variant is while that being very scary and transmissible, the vaccine is just as effective against that variant so far.
That's great to hear.
Yeah, you know, I think about the question about, are we going to have to get booster doses? We don't know. I mean, it's possible that we're going to, you know, a year later or something like that, that it's going to make sense to get a booster. There might be some evidence that's helpful, but that's just a question that we just can't answer.
Great. And then Jessica, you know, she's got a good question. If we finally decide that we're ready to get the vaccine, getting one seems to be the next challenge. So Jessica's got a question about priorities.
There are not enough vaccines for everybody yet. I cannot get a vaccine yet because I am not on the priority list for vaccination at all. Our state is setting priorities for more vulnerable groups of people to get it first. The most at risk are people who are living with other people and have multiple caregivers, like the elderly or people with disabilities who live in nursing homes, adult family homes, supported living, and other settings outside their homes, but many people with disabilities live in the community. Like I do, how do people with know when it's their turn? And are people with disabilities living in the community vulnerable too?
Yeah, so that's a really great question, Jessica, about how do you know when it's your turn? And can you advocate? How do you get, once your turn comes up, then how do you get it? I don't know. I don't know if there's a better way yet to know when your turn comes up, other than going to the website with the Department of Health, the Washington State Department of Health website. I think it's called Find My Phase WA.
Phase Finder.
Yeah, and it's a phase finder. And when I click on COVID Washington Department of Health, is the first thing that comes up when I Google it. So, and then what you do is you put in all your personal information about how old you are, what conditions. It asks several questions, and then it will tell you whether you're whether you're ready to get the vaccine. We know that these groups that you mentioned, Jessica, that live in supported living environments where there's a lot of employees rotating through, those people are at real high risk. And so those people have been prioritized. But if you live with an individual that's caring for you, one person, like let's say you're a family member, you may not be eligible yet. The other thing that I'm telling my patients is just to, like for instance, my patients at UW, we have this tool to connect with your doctor called eCare. And so I'm telling everybody, go every week, just check in. And because that will also is likely going to be telling you, and that'll often be where you're going to ultimately get it. Although the nice thing is there's coming up now several different places. I think, Alan, I think you were saying that there's Department of Health also has some ways to get it, even if you can't get it through your doctor's office.
Yeah, I think it's worth, looking, depends on where you live, but the state phase finder is, the #1 place to figure out where you are. I would say most county health departments now have a website. Pierce County has a very nice one, and it both helps you figure that out. It also has vaccine sites, so you can figure out where the mass vaccine events are, which pharmacies are offering. And I would echo what Gary said as far as the health organization. My organization, Multicare, has a COVID portal. And if you have an electronic chart that, access, you can go in there, and that's where you actually schedule your appointment when you come up priority-wise. So there's several, I wish it was simpler than that, but there are several ways that you can get it. Your own health system, mass vaccination events, and pharmacies. And for our community, of course, if you're in assisted living or group supported living of some kind, you may be able to get it that way.
Yeah, and I think this is where it's been really confusing for people, because I think when you go on to the news, like national news, the thing you have to understand is that every state is different. So every state has their own system and has their own priority. So for instance, Stacy, you mentioned earlier, before we got on, that Oregon State did prioritize people with developmental disabilities. I heard in 28 out of 50 states, teachers have been prioritized, but not in Washington State. So there are a lot of people that want it, and every state is deciding differently on kind of how to prioritize these groups. So it is very confusing.
Yeah, we've got a question in the chat that says, what happens if your caregiver hasn't gotten the COVID shot yet?
I think, asking when their agency is, getting set up for a vaccination kind of time period. I know like the Copic County just had their second vaccination clinic this last Friday, getting most of the staff in the building, and it had already gotten most of their supported living staff with that one example of a supported living program. So if you have a caregiver, definitely connecting, asking them, hey, what's your agency been doing to coordinate that? A lot of agencies have been then coordinating with like larger pharmacies like Walgreens, for example, to kind of set up vaccination clinics. So definitely should be something you should feel comfortable asking your caregiver, hey, what's on the radar, what's on the schedule for their agency.
And recognize that at this moment in time, no one is required to get
That's
a vaccine.
true also.
Good point.
And that applies to individuals, and as patients, it also applies to your caregivers. It is an emergency use authorization. So, I think the data behind it is great. We feel that the vaccines are safe, but it's sort of a brand new thing. And because it's this early authorization, no one is required, no one is mandating. So I think you can encourage your caregiver.
Yeah.
Protect themselves and protect you. And that's what I'm personally saying to caregivers is I'm recommending it, but it's not required.
That's a great point, Alan.
Yeah, I think it's important to know that for people whose loved ones or for individuals who are in adult family homes, the rollout has been a little slow. And that's part of a pharmacy contract. So if you have a loved one or you are in an adult family home and you haven't gotten your vaccination, you want it, it sounds like it's a matter of advocacy. So you can wait for your provider to do it, but can you also as an individual just try to sign up and then you have to use your own transportation to get to
Mm-hmm.
the shot. Has that been your experience?
Yes, unfortunately. I mean, in some ways, unfortunately, but it is true. I've certainly had some families and patients that have traveled distances to go to pharmacies out of their county and have been able to get the vaccine. And I've heard the comparison to the movie The Hunger Games. It feels like we're really scrambling at this point. I really hope that we're going to get to a stage in these next coming months that the supply is going to finally catch up with the demand. But it's going to probably feel a little scary too. You know, I think it's like when we're waiting, you know, just for something that can be so valuable and is a tool for us to get back to closer to feeling like we're a little normal. You know, being able to get into our community more and feel safer. But even with all of that, you know, we're still it's really important that we get comfortable with our masks and that we spend a few extra dollars to get really comfortable, good quality masks. Because I think we're going to be wearing those, you know, through the summer months and into the fall at minimum. So have your good masks with like a couple layers if possible to the mask. Make sure it fits really well over your nose and your mouth and tucks around your cheeks, because I think it's just really been amazing how effective the masks have been. You know, at the beginning of the pandemic, we didn't realize how effective that masks were going to be. And so that's also been confusing because the story has kind of changed through the year. But yeah, masks are really, really good, and we're going to need to continue to wear them through the summer and the fall.
Yeah, that's a great point, Gary. I think a lot of people are asking that question. Can I be free of my mask if I get vaccinated?
Yeah.
And the answer sounds like a resounding no.
Fortunately, yeah.
Yeah, I mean, I think where people have really where I've listened to some of the experts and say, well, what if I'm with just a couple of my friends and we've all been vaccinated? We've all been vaccinated and we're outside and it's a nice sunny day. You know, I think if you're 6 foot distance and you're outside and you're all vaccinated, maybe that's a point where you do weigh that risk and benefit. But I guess my point is always, well, I'm going to go ahead and wear it and play it safe, but everybody gets to make the decision, you know, on their own.
Something where, again, you're protecting other people. It's something that if you can do it, it's great. And we understand that not everybody can. It's just that the people who can, it, you know, helps protect. And I think it's also, you know, it just points out, you know, herd immunity is something that is not a specific number. You know, it depends on the virus. You know, the herd immunity for the measles had to get to 95% before then essentially it was no longer a concern. We don't know what that percentage will be for COVID, for coronavirus. And it's going to take a little while to at least get to 80%, which might be a first goal for the scientists with the CDC, Dr. Fauci, to kind of be able to look at everything and say, hey, how are we doing at 80%? And can we back off on some of these restrictions?
I think we're learning how well does the vaccine, I mean, the worry is having asymptomatic infection with the vaccine and then spreading. Yeah. And I think we're slowly learning. There's some data coming out of Israel where they've had relatively high vaccination rates. And I think we're going to learn more about how safe we are to turn some of this down. And then there's the variants, which you've already talked about. You know, so I think there's a bunch of things happening and we'll know more with time. But I think we just have to listen to the experts to help guide us to safety.
That's great. And Jessica, on this line of thinking, you had a question about people who are socially isolated wearing masks and how hard it's been. Do you want to ask that question?
Vaccine equity committees at the State Department of Health and at local hospitals like UW and others have been meeting to think about the unique barriers that people with disabilities face in getting access to an appointment and waiting in line to get the vaccine out in the cold. How do we help the state and local clinics understand how to make the vaccine most accessible when IT is someone's turn? What if I cannot get access to transportation to get to my vaccine appointment? Or what if I have a hard time with getting shots?
So, I think that's a kind of got multiple pieces to it. One of the pieces I think is important for our representatives in Olympia, our legislators, to hear your voice. And if you can continue to advocate, that is really strong. So if you know your legislator that represents where you live, send them a message, leave them a voicemail. That's very, very important. I think we signed on a letter that went to the governor a couple of weeks ago. So if you can have that opportunity to advocate, that might be helpful.
And I'd also just say that, everything is relative. My experience is not going to be the same as everybody else's, but I really just feel like that needle that I got in my arm twice, the first time I barely felt it, the second time I could feel it for sure, but this is not a giant needle like for a blood draw. This is a very tiny needle that people are able to use these days. So I hope that it's not painful for people.
Mm-hmm. I know my UW organization is going to be trying to develop ways to get out to people's homes that can't come in. Right now, the supply is so short that they're really having to centralize. I had one of my parents whose son is very needle phobic. They did a great job of scheduling their vaccine together. They went in together, and dad got his first, and then son was more willing to get his, having seen dad get his. So they're, coming up with strategies like that, but it's hard. We definitely know it's going to be hard for some people.
Yeah, those are great suggestions, because a lot of people have asked, how do I help my person get through getting that shot? And that's really valuable advice. Jessica, you've got another question coming up. It seems like that should come next.
Being socially isolated and wearing masks has been hard, and it's really hard for people with IDD. Some people are feeling so isolated. If all of my friends have been vaccinated, can I hang out with them safely? What would you suggest for people with IDD to be able to feel less depressed from the isolation and the lack of human contact?
Well, I really feel for this question. This is I think we all feel this, but I agree that, some people I know that I care for really has been hard on them. And we know that we've seen some data from the Department of Health about increased levels of depression in the population across Washington State. There's also some interesting data about living through a chronic disaster, a disaster that lasts longer than 6 months, which this is, and how there's increased risk for depression. And so that needs to be considered. We need people to be healthy, both with their physical health and their mental health. And that's where I'm advocating for, especially this spring, of if you can get the vaccine, of feeling more comfortable about going outside, going for walks, meeting up with your friends in parks. You'll still be able to 6 foot distance. You could have a meal 6 foot distance and being outside. Restaurants, it's a lot harder because the circulation in restaurants is just not good. But outdoors, getting together with your friends, I think you can feel more comfortable doing that if everybody has been vaccinated. We're learning more about this, as Alan, as you said. I think maybe we'll feel even more comfortable making those recommendations. But again, everybody has to, continue to be careful because we're getting close to getting through this. It's hopefully before this year is out.
And I think, you know, there's obviously virtual activities, you know, our metro parks and some of our community activities have done virtual things. As the weather gets better, I think some activities will come back with more spacing and outdoors. You know, things were starting to come back, and then we had this huge fall surge, which, you know, was got everybody's attention. But I think, you know, I'm hoping that this spring that some things will start to begin to open back up a little bit more. And of course, some in the school age, special ed is among the first to go back in school. So I think there are signs of hope to beginning to be able to do things together. But still, as has been said many times, we've got to be careful still.
Yeah, and on that note, you know, you mentioned that kids under 16 don't get the vaccine, and we had a lot of families write in with questions about their children with special healthcare needs and children with disabilities going back to school. As you know, for a lot of kids with disabilities, it has not worked well to have remote learning and virtual learning. And there's a lot of regression and maybe some long-term effects from not having access last school year that people are worried about. If teachers are vaccinated, should parents or family members worry about sending their children with disabilities back to school, especially if there's not a vaccine for kids under 16?
Well, I mean, we know that, yeah, go ahead. Go ahead, Alan.
I think that's almost an individualized decision, really. And we can't give you a blanket answer. I think some of it has to do with, medical issues and vulnerability. Obviously, it would be much better if school staff and teachers can be vaccinated to help that be a protective bubble. You have to do the distancing, et cetera. School age kids seem to do better, but I think our particular population is a unique one.
Yeah.
And I think each family will have to think about the individual medical vulnerability of their child to make that decision. So I think that's a discussion with your doctor, frankly, to decide when that's safe.
Yeah, I think on the policy side or advocating within the school, I think some things to consider advocating for would be extended school year and improvements in circulation in the classrooms. So I think or hybrid classrooms that are conducted more outdoors, especially as we get into the spring and summer months. So those are all of those would be mitigating things that could help reduce the risk of spread. Also the idea, I know a lot of schools are looking at forming individual pods, where there are a smaller number of individuals that you're exposed to. So if somebody does test positive, you can control that better. But these are, again, ultimately, if you're talking about your loved one, I think Alan's point about you really going to have to take that on an individual basis.
And I think it was a particularly tough year for transition. The young adults who are in their last year of transition, which is such a critical year in terms of job skills and working with Division of Vocational Rehabilitation. And I'm honestly not sure what's going to happen with all that. I feel like somehow we have to try and remediate that. But I have not heard any sort of clear, coherent response to that at this point.
That's a good point. We'll keep you posted on word that we have that our state will be looking at that extra transition year.
Yeah.
Well, we're wrapping up for the last couple of minutes. I wanted to check in with you guys and see if there's anything that you think we might have missed, or if you have any closing thoughts for us tonight.
I think it's already been said in a couple different ways with Gary and Alan, but I use kind of a three-pronged approach when I'm thinking about kind of my risk for meeting up with people. One item is, is it outdoors or indoors? Outdoors being preferable. Second one being, can you mask up, or you can't mask up because you're eating a meal, for example. And the third one being, can you maintain 6 feet? And if you can do two of those three at any one time, you're doing pretty good. But if you're not only able to do one at a time, then you're kind of at much higher risk. So if you can, maybe do all three, that's the best. But as long as you can do 2 out of 3 between those things, then you're also kind of reducing your risk relatively well, I would say. That's
a great tip.
Yeah, I like that.
I like it a lot. Well, I can't tell you again how grateful we are. We appreciate each one of you for spending your evening with us here tonight. Just a reminder, this is being recorded, so we'll have it out on the website as soon as we can. And I hope all of you stay safe and have a great evening.
Great. Thanks, everybody. Stay safe.
Thanks, everybody.
Everybody.
Bye. See you, Stacy.